Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined today, as always, with Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. I'm excited about our topic today.
Our topic is an awesome one. It was actually recommended by our amazing producer, Nils, who wanted to know more about scars, because every scar tells a story.
There has to be a song about that, I think.
Every scar tells a story? I don't think so.
Okay.
There's a lot of songs about the things that lead up to scars, like, fighting and drinking and heartbreak, but the scars themselves.
Like all the scars I have in my body could be transcribed into one amazing story, one saga.
Right? Story of your life.
Everything has a story. So our whole business is based on scars. Everything that we do is based on promoting good scars. Every surgery we do causes a scar, and we try to help that along with healing. And that's how our results actually turn out really well.
Yeah, and I always find it kind of funny because people always ask, like, am I going to have a scar? And the answer is always yes. Like, you will absolutely have a scar. However, not all scars are the same, and a cosmetic scar is different than a traumatic scar, and we'll talk a little bit about that. But I think to kind of explain why we have scars, it's kind of helpful to talk about the process that causes a scar, like how a scar is made.
And I want to say that we were talking about this beforehand, the process of scar formation is truly amazing. It's like one of the most complex components of our physiology.
Well, we're basically regenerating. We are self-healing.
Yeah.
I always think it's funny because, like, wasn't it Wolverine who could heal himself?
Right.
Like, we can do that.
In utero, that's the thing. So they have done surgery on babies before they're born, so fetuses, and they did the surgery, and they've done open heart surgeries and stuff to really give them viability when they're born, and their scars are not evident when they're born because the cells that they have there, the whole process is still pluripotent, meaning that their stem cells that are floating around just heal everything and return it back to what it was beforehand.
Right.
We can't do that now like Wolverine. That would be sweet.
It'd be cool.
Maybe in the future with stem cells, all these new treatments we're learning, but the process of forming scars is truly an amazing process.
It is, and it's the same for any scar. So we've said this many times on our podcast, your body doesn't know the difference between a traumatic injury and a controlled injury, meaning surgery.
That's always a funny conversation. So it's basically the same to your body as getting shot in the face or getting a facelift, right?
Right, or getting run over by a car, having liposuction. Like, there's massive soft tissue damage where you hit by a vehicle.
It's controlled motor vehicle collision.
Yeah, it is. And so these processes happen, and there's basically 4 main phases of wound healing. And it's funny, those of you who don't know me well don't know that I taught anatomy. So when Dr. Martin asked me if I could, make the slides for this podcast, I'm like, oh yeah, I got this.
You got this.
I got this. So 4 phases, and we'll go through each of these in detail. But basically the first one.
And look on our YouTube channel, Jason Martin MD. You'll see all these slides.
Yeah, if you want to see these slides and the fun pictures that Sarah put in for us. So phase 1 is basically when the bleeding stops. Phase 2 is when your body kind of starts its defense and inflammatory process. Stage 3 is when things start rebuilding, and stage 4 is kind of the longer term phases of scarring. So we'll start with phase 1, which I called the bleeding stops or hemostasis. So this is emergency, right? All hands on deck. Something is wrong. Your body's releasing thrombin, which is going to be released at the site of the injury, to initiate the formation of this little fibrin mesh that's going to strengthen with the platelets that are also in this area to form a clump into a stable clot.
So the big player here is platelets. That is what makes the difference. So anyone listening to this episode, you're going to learn a little biochemistry, but if you have a sick person and their platelets are really low, that's why it's could be life-threatening, because the platelets are hugely important to any injury, right?
Yeah. And
platelets release other factors. They come in and basically form the plug so you stop bleeding and then lead to the other phases that Amy alluded to before.
Yeah.
But that thrombin plug is very, very important to healing. And if you can't form that thrombin plug, you'll never get past the first phase.
Right, and that's important to stopping the bleeding. That's why.
But
why
also going on to wound healing.
Correct.
Yeah.
But it's why we don't bleed out from a paper cut.
I feel like I bleed out from a paper cut sometimes.
Yeah, so like from when you nick yourself shaving, like, how is there blood running down my leg from this tiny cut?
So one of the big problems in Colorado is because it's so arid is the nosebleeds. Mm-hmm. And I'm like, where are the platelets when my nose bleeds?
It's just taking them a while to get there.
I know. So platelets can't like if you have a large cut, they obviously bleed for a while. Platelets can't stop all bleeding. But definitely on a micro level, on a localized level, the platelets come in and help this thrombin clot form.
Yeah, and platelets are little proteins essentially. So they're little, protein is kind of the makeup of platelets.
Yeah.
So that's what's going on. So
It's a blood product. I mean,
Yep.
we actually give platelets to sick people sometimes when their platelets are low.
boost up their blood.
Yeah.
Yeah. So that's the first step. So we got to stop the bleeding before anything else can happen. Before wound healing can begin, the bleeding has to stop.
So if you have a crack in the dam, you got to stop the water from coming out first before you repair it. That was a really good analogy.
That was a good one. I'm usually the analogy person. That was good.
I'm really proud.
Yeah, I usually come up with the random analogies.
We'll submit that to the analogy competition.
Okay.
All right.
Stop the bleeding. Okay,
Yeah.
so phase 2 is the inflammatory, but it's also the defensive phase, essentially. So this is when the body's bringing in all these building blocks. So specifically, neutrophils are going to be entering this wound to kind of clean up debris. They're also going to kill any bacteria that might be present. Now remember, your body doesn't know how it was injured, so it's going to go there and make sure that there's nothing harmful there. It's going to kill bacteria. It's going to clean up anything that doesn't need to be there, tissue that's been damaged past the point of repair. And this lasts for the first couple of days. So after that, these neutrophils start to be replaced by more permanent cells, which are called macrophages, and they continue to clean up.
Macrophage.
They also bring in other cells from the immune system that are going to help with tissue repair. And this is also a short process. Like this inflammatory or defensive phase is only about a week, like 4 to 6 days on average.
But this is hugely important from an evolutionary standpoint. If you get cut and bacteria gets in that wound, the neutrophils come in, they're like the bouncers. They come in and take care of business.
Yep.
So they throw out all the bacteria, they encircle it, release all these cytokines, which are like
like digestive enzymes.
No, they're like they notify the body like, hey, you need to bring in the big guns. We need to take care of business over here, and that's huge. That 4 to 6 days after an injury, that's why you want inflammation. And we'll talk about this. Like people will say inflammation is terrible. We got to stop all inflammation. That's why we're all dying. That's not actually true. Inflammation has been developed in our bodies to help us survive in life and survive injury. That inflammation takes anything that's in there and it walls it off and it gets ready for business, for rebuilding and doing what you need to do to repair the injury. And neutrophils are the most important factor there. So with wound healing, you have a progression of the type of cells that come in. So we first talked about platelets, and now we're talking about neutrophils, and then we'll go on to macrophages. And macrophages are like the big daddies. They come in and really do take care of business. So they start absorbing some things that you don't want there. They release more factors to bring in things that will hopefully rebuild everything there. And they just control the whole process going forward.
Yeah, bringing all the leukotrienes and everything that's going to heal. And it's definitely a time when, the things that are associated with this phase are things like inflammation, also heat, redness, so there are also things that people look at, they're freshly healing surgical wound and like, oh my gosh, it's red. Like, yes.
Right.
Like 2 days after surgery.
We get this all the time.
Yes.
It's a week after surgery, week and a half.
Or
Okay,
it's
so
3 days.
3 days, and they're like, oh my God, it's so red. Is this going to look like this forever? No, this is your body doing what it's supposed to do.
Yeah.
This is how it heals. The redness is good. The redness is showing that you have all the cells in there. They're healing right. It's okay. And that redness will go away. Now, sometimes the redness doesn't because of neovascularization or new blood vessels going in there. But in most cases, that redness is wanted and necessary. If you cannot create an inflammatory response after an injury, you will not heal the wound.
Yeah.
And we'll get to that too because, for example, people take steroids. They can't get past this point, right? Mm-hmm. Because they can't mount this inflammatory response. Steroids limit inflammation. Obvious. I think most people know that. You take steroids when you're inflamed, and your wound won't heal.
Right. And that's prostaglandins are what kind of control a lot of that inflammatory process. And we've talked a lot about those on other podcasts, but they are pro-inflammation and also anti-inflammatory prostaglandins. So prostaglandins get a little bit of a bad rap in that they're pro-inflammatory, but they are also what helps take the inflammation away.
So there's a lot of things that get a bad rap. Inflammation, prostaglandins. We need to have a support group for all these
like you're okay,
body components. Yeah, you're pretty
a
good.
Healthy hormone. You're good hormone.
You're good.
You're the good kind of
We
fat,
like when you
right?
inflame at the right time and then take away inflammation at the right time.
Yeah, and the other thing that is helpful with inflammation, specifically around an injured site, is it does kind of self-splint it. Like let's say you've, injured a joint, that inflammation will prevent you from being able to use it in the full range of motion, which will also keep you from re-injuring it in some cases.
Right.
So it really is a beneficial thing, and you do need that.
Yeah, I mean, this, if you believe in evolution, this is all based on evolution. I mean, over, the millions of years, really. I mean, humans in their current form haven't been here that long, but this is what has developed for us to survive. And injuries are a part of life. So
They are.
we do controlled injury, which is really odd to
Surgery,
think about.
yes.
Yeah, but that's the way it goes. So you definitely need this inflammatory phase, super important. And then what happens after inflammation occurs, Amy?
So this is a much longer phase. This is going to last anywhere from where the first phase ends, so day 5, to up to day 24. So about a month after your initial injury, there's proliferation, and this is actually 3 phases in and of itself. So it's filling the wound, contraction of the wound margins, like bringing the edges together, and then covering the wound. And I think this is where the real difference between a traumatic injury and a surgical incision really come into play, because a lot of these things, we actually kind of do some of this, right? Like when you're closing an incision from surgery, you close all the layers going up. So there's a lot less work in this for your body to do. It doesn't have to fill in a large area of missing tissue. You're replacing it. So there is much less work for the body to do in this phase. It still happens in the same way, but it's a lot easier. So in this phase, you're getting new blood vessels are formed in this area. There's going to be, especially if it's an open wound or a large area of wound, like a road rash or something that's open, like a burn, there's going to be this granulation tissue that kind of comes and fills it in with connective tissue. Wound margins are going to start to kind of pull in. You've seen that if anybody's had a big injury, you kind of see how it like heals itself down, essentially.
Contracts, we call it contraction.
Circles in across the center. And then as that's happening, there's these certain types of epithelial or skin cells that start to kind of frog leap across that area and eventually fill it all in with skin. So something that does happen in this phase 2, though, is as in both of these phases, phase 2 and phase 3, you start to get lymphatic, tissue kind of coming back. So that's why people will get some like oozing of wounds. People, that's another thing, like you see any fluid coming out of a wound, they're like, oh my gosh, it's infected. Like, no, like some of this is that especially during this granulation phase, like those new tissues are going to be wet, essentially.
They're going to be weepy. Yeah.
So it's not scary. Like that's part of this process. That's why that's happening.
And fibroblasts are huge here. So we talked about platelets. We talked about neutrophils, and then the macrophages come in. And those, we talked about macrophages in a previous podcast. We called them mad dog.
Like street sweepers. I call them street
the
sweeper.
mad dog, whatever the guy was who.
Take no names, clean it all up.
Mad dog Mattis. We taught him mad dog Mattis. That was the macrophages. The fibroblast really gets stuff done. They come in and they start laying down the collagen. They bring in the myofibroblast, which helps with contraction. They are basically probably the most important part of long-term healing. And if you have a problem with your fibroblast, you're just not going to heal, period.
No. I would say, like when I would be teaching this in anatomy, like the different types of cells, like fibroblasts or osteoblasts, like you think of them, they're the builders. Like they come in, they like blast it out, like they
Bob the Builder.
Yeah,
Yep.
like they bring stuff in, like as students would get confused and think that a blast was to break down, but I'm like, no, like think of it the other way. Like they come in and like build it all out.
Yeah, they take care of business.
Blast it out, yeah.
So,
yeah.
I mean, if you use the dam analogy, you have a crack in the dam, the water comes through. First you stop it, and then you assess it and start removing the bad parts, and then you start rebuilding it. And that's where we are now, the proliferation phase.
Yeah, you're filling it in.
Yeah, filling it in.
So something else that kind of happens in this phase, these cells are obviously replicating all the time. So these epithelial cells, they're replacing themselves all of the time too. So they are going to be repeating the same DNA process. So just kind of keep that in mind.
It is funny. So you think about this and you read this stuff like when you're in medical school and you're like, okay, step 1 happens and then step 2 and then step 3, but it's like always going on.
Yep.
Like constantly, even when you're not like you don't have a formal injury, there's like these micro injuries and you have all these different phases going on universally.
Yeah, and these things could be happening inside your body in some ways too, because you're always repairing things. Think of working out, like lifting weights.
I was going to talk about that. So if you lift weights and you want to get like bigger muscles, you need inflammation because when you injure your muscles, that's when you get a repair. It gives you more muscles, and that's how you get stronger and you look better.
Right, and those muscle tears are what are causing the muscle to need
you need
to
to tear your
and
muscle.
grow.
You need to injure a controlled injury. Yeah.
Same thing with a cell that maybe is not functioning well. Like your body needs to send in some macrophages and to get rid of that cell. Like break it all up, see what usable parts are there.
You're kind of like my macrophage. I think in my professional career, you're my macrophage. You come in and you take care of business. You want to ask me a question, you talk to Amy, the macrophage. She'll take care of business.
See if we can get through
and then
this
you bring
wall.
in the fibroblasts and whoever else needs to, rebuild the stuff.
Like,
So thank you for being my macrophage.
bring in some leukotrienes.
All right, what's the fourth phase?
So the fourth one, this is the long term,
Oh,
right?
yeah.
So this is maturation.
This
of
is
the
where,
scar.
oh man, our patients struggle through this part, right? So they've gone through the redness. The scar looks pretty good, especially in our hands. And then we tell them you got to wait months for it, to really remodel and get to where it needs to be. I mean, over a year many times.
Actually, up to 2 years is what, really truly, like, your scar is in this process for anywhere, estimates are from 21 days to 2 years. And you can kind of think about that, right? Severity obviously is going to play a huge part in that. If you have a paper cut, you can probably forget you had it in 2 weeks because it's gone.
I mean, the paper cuts always hurt so bad.
They do, and then they're gone. Like,
I don't understand.
They hurt so bad.
I know.
Ugh. Or charts. Yeah, that's why I was so happy when we got rid of paper charts because, man, like,
electronic medical records is the best thing ever happened to medicine.
chart cuts were the worst because they're thick.
So we talked about this in a previous. I wish I should have gone back and checked, but we talked about this in a previous podcast. I used the analogy of Lincoln logs. So when collagen's put down, it's disorganized. So all the Lincoln logs are like fall on the floor.
Yeah, it's like somebody just threw the Lincoln logs in
And
a
then
pile.
you take the Lincoln logs and you start organizing them in the same direction, parallel. And that's what happens during the maturation process. That's why your scar looks like raised and angry. And then over time, all the collagen on the inside, which is what a scar is made of. And by the way, the collagen is synthesized with the fibroblasts there. The collagen starts to organize in more parallel fashion.
Yeah, they line up. And that's, with scar massage, that's why you'll massage a scar in a certain way, is to kind of help encourage those formations.
Pressure helps the collagen reform. Even when we inject steroids, that limits chronic inflammation, which then allows the remodeling to occur better. Okay, so there's a lot of therapies we do after surgery to help people remodel better and make their scar look better.
Yeah, and we'll talk about all of those. So during this phase, a couple of things that are also happening is that the scar, as it ages, essentially, it kind of rebuilds the strength in that area. So that's important for our patients, right? Like if you've had a tummy tuck.
Does it go to 100%?
It doesn't. It goes to around 80. In best case scenarios, about 80% of its original tensile strength. So there is always, your body was damaged, and depending on the extent of the damage, it's, if you've had an injury.
If your house burns down and you rebuild it, it's not the same house. I mean, it's like kind of like the same house.
Right. It's pretty close. It's pretty close.
Yeah.
Depends on who the builder was.
Right.
It's pretty close. So so that process continues to happen over time. Your body is obviously doing a lot of other things at the same time. So the more kind of energy you can direct towards your recovery, the better your scars are probably going to look.
Amy, I'm going to get liposuction and I'm going to diet afterwards because I want my liposuction results to be better. Is that good?
It's a terrible idea.
Why is that
After
terrible?
any surgery.
Why is that?
You don't want to limit your nutritional intake after
But I want to
surgery.
diet. I want to diet. I want to look good.
Well, your scars are going to look terrible, or your recovery is going to be very hard.
Right, because every one of these phases take energy. It takes a lot of energy, a lot of resources. And if you deprive yourself, which in some ways can be good in certain times of your life, it's terrible for wound healing.
Yeah, fasting is not going to benefit acute injury or wound healing or recovery.
In the old days when we didn't have supermarkets right next to us, if you got injured, you were better off if you had some reserves to heal.
Yeah,
if you had some
absolutely.
nutrition,
Yeah.
maybe even a little bit of
Some
fat
stores.
on your bones. Yeah, exactly.
Yeah.
To help you heal yourself through this process. So.
Yes. Yeah, it is very important. Most of these processes, as I mentioned in the beginning, that's a protein. Platelets are protein. A lot of these kind of facilitators of wound recovery require proteins to make them happen. So if you are severely limiting your intake of protein after surgery, it's not going to be good. If you're limiting your intake of fats, these are necessary precursors to the hormones that are necessary to cause these functions to continue to happen. So you're really setting yourself way back after surgery if you restrict your nutritional intake. It's really not a good idea.
Because every one of these phases takes things that you eat.
Takes nutrients.
Takes nutrients. For example, there's something called scurvy. And scurvy is a lack of vitamin C or ascorbic acid. And ascorbic acid is absolutely necessary for some part of collagen synthesis. If you don't have vitamin C, you can't form collagen, and then your wounds all break down.
Well, and you can't store vitamin C. So that's actually a very important. We've talked about that in our nutrition
you did.
podcast about
You did.
recovering from surgery, because
that was a good episode.
Vitamin
That's one of
C
my
is
faves.
so key for wound healing,
Right.
but you can't store it. So it's not like you can just take 10,000 milligrams of vitamin C and be good for a week. You can't. Your body's just going to excrete that, and you need more the next day.
My son doesn't eat fruit, and I was like, "You're gonna get scurvy," and he's like, "I don't care."
You get vitamin C from other sources, but
It's like whatever.
yeah.
Cool, Dan.
Yeah. So
Whatever.
I think this kind of leads us to like, wow, I am Wolverine. My body is literally able to heal itself, which yes, it does. But then the question becomes, well, if this is happening, then why don't scars just completely disappear?
Yeah, why don't they?
Why doesn't your body just go back? And I told you the epithelium like kind of leapfrogs and goes back over. Like you think like, okay, well, why wouldn't that just go back to normal?
Yeah.
The issue is I put in here, it's all about that base. It is, because cells are replicating from the bottom up. What you see on the surface of your skin.
Do you think anyone got that?
About that base. Nils says he got it. I got the thumbs up from Nils. No trouble. So your cells are replicating deep to superficial. So they're coming up essentially. So as the very surface of your skin that you see is actually multiple layers that are kind of cells that are being pushed up. Like they're all being squished up, and as they get closer to the top, they get flatter, and that's why your skin is really smooth on the top. But these cells underneath are thicker, but they're replicating the same DNA of the cell before them. So if they are forming in scar tissue, as your body is healing, those cells are continuing, those epithelial cells are trying to grow. They're getting this message that we're creating damaged tissue. So that keeps happening. So that's why a scar can fade almost completely, but it will never entirely go away because those cells that are deep down are forever programmed to have this scarred appearance.
So when I do a scar revision, that's why the scars look better ultimately. I mean, obviously they never go away whenever you make that incision,
Right.
but you decrease the area, the surface area where that kind of scar was.
Yep.
Which then leads to the cells on the outside of that being normal. And so your scar is thinner and less obvious.
It's better. It also gives it that chance to do that again, so that, like you said, the area and the amount of cells that are replicating abnormally in that area, that's not abnormal, it's normal, but that are scarred is reduced.
Nice.
You're taking out a large chunk of those cells that are programmed to scar, essentially. So that's why we are not entirely Wolverine like we do Scar.
No, you're dropping some knowledge right now.
Yeah. But it's kind of cool. I mean, and that does, you always do think that. That's why when people ask, like, will I have a scar? Like, well, yes.
Do you see it like that?
No.
You make them feel bad?
No, and it's not that.
Do you say, you stupid patient?
No, it's that I wish that, want them to understand this, that
No,
yes, a scar will be there.
I mean, FYI, don't feel bad if you don't understand this.
Yeah.
And if you made it this far, just know that they don't even really totally know what's going on.
This is us just watching what the body does.
No, this process is so complex. The number of factors that are involved, hundreds. There's whole conferences based on this. It's going to take AI and supercomputers to figure all this out moving forward.
Because all we've talked about so far is normal wound healing. We haven't talked about the crazy abnormal things that can happen. And that's really where we brought this up when we were talking about stage 3. What makes a cosmetic scar different from a traumatic scar?
There's still a scar. I mean, it's still a scar.
But why does, let's say, I have a huge scar on my shin from where I had stitches when I was 12 that, is barely visible now, mostly because I'm so pale, but is, probably a 1/4 inch wide, and doesn't look great. I cut it on
I'm glad
a
you brought
bike
it up.
pedal.
It's been kind of bothering me.
Right?
I think we need to
It's pretty
fix it.
hideous. That's
Yeah.
why I wear scrub pants, not scrub shorts.
It's kind of embarrassing.
It's really hideous.
Yeah.
But there's a big difference between how we leave a wound, versus how a trauma might leave a wound.
The less work the body has to do to heal a wound, the better the scar is going to look.
Yep. So,
For example, thin skin, thin scar. So
Yep.
in your eyelids, the scars heal great. I've rarely seen even in a hypertrophic scar, much less a keloid scar of the eyelids, and that's because the body doesn't have to do as much work. You can get the epithelialization or the skin coming across quicker. It doesn't have as much layers to go through. It does it quickly, and then you're healed.
It's also highly vascular.
Yep.
Lots of
Great
good blood
vascular
flow.
place. So even if someone has poor health or maybe not the best choices in terms of a lifestyle, they tend to heal that a lot better than bigger wounds in less vascular areas like the belly.
Right, or something say on the foot on a diabetic that's
Yeah.
going to have really a lot of trouble healing. If they're not getting great oxygenated blood, they're maybe nutritionally compromised, their blood sugars aren't stable. Those things all affect how a wound heals.
Sure.
So big difference between that, that kind of injury in a traumatic scar or traumatic wound versus a very controlled facelift incision. Both are going to have a scar in the end, but one scar is going to look far better than the other just based on...
So I thought my facelift incisions and scars look great because I'm an awesome surgeon. So you're telling me it's purely based on the anatomic location.
No, I'm telling you that is why. That's why tummy tuck scars look great too. That's why when we did that crazy skin cancer excision in between that woman's toes. Do you remember that?
Yep.
and that healed great.
Yeah. So I do think technique is involved, but
Technique.
it also the patient's past medical history,
Current
the things
history.
that they deal with, what they did after surgery, the scar treatment, scar care, all of it matters.
Yeah, those things all matter. And that's,
How can you improve the appearance of scars? This is what the next slide says.
yes. So there are a few ways, and some of them you can do yourself. So to me, the biggest thing you can do to improve the way your body scars is, of course, I'm a nutritional therapist. I'm going to tell you the things you're putting in your body, how you're taking care of yourself, and how your health is. Absolutely are going to make a huge impact on how your body heals from
Right.
any injury or surgery.
There are limitations. Some people have disease processes
Yep.
that limit them. Age, every decade of life, you heal
Mm-hmm.
worse, not better.
But nutrition is going to help a person of any age
Gotcha.
to optimize their healing. You can also use topical treatments. So scar creams and scar tapes are very beneficial. We don't really understand entirely why silicone helps scars, but it does.
I read I don't know if this is still the case, but I read an article one time and said that silicone somehow imparted a charge on
To
the
the
wound.
collagen?
Yeah, to the collagen, and it allowed it to remodel better.
That's what I'd always heard too, is that it allows it to organize better,
Yep.
that it organizes those collagen fibers more.
Keloid sufferers, I used to do those in training of the ears because a lot of people have darker skin, have pierce their ears and get the keloid of the ear. So we would excise them out, remove them, and do pressure therapy. So
Compression.
it's kind of like almost like a pinchy, not full earring. What do you call a fake earring that just kind of
clip-on?
clip-on? Thank
Yeah.
you.
Oh my gosh,
What is
the-
that called?
right,
The
clip-on.
thing that clips on your ear. I'm not sure what that's called.
But they're crazy because they screw down. Like they're these crazy little things. They're clear.
So it's like a bigger clip-on.
Yeah, it's like a big flat clip on, and it has essentially like a screw that you can make it tighter. So
Yeah.
you screw it just tight enough, and you keep that pressure on, and it can really help the appearance of a scar. And part of that's just because it kind of gives your body the signal that like it's enough.
Right.
Like you don't need to keep doing this.
Steroids do the same. They decrease if you have someone who has inflammation past that 5 to 7 days. Remember, we talked that's really important. Injecting steroids will limit that inflammation and allow your body to remodel. Amy always talked about here, at least on the slide, surgical repair. You can always do that. Re-excise this bad scar. We do that intermittently with great results. Chemotherapy is a really good option. And actually, something that's not on here is localized radiation, which is really interesting. So what that does is basically kill all the cells that are in there. So this chronic inflammation, chronic scarring loop that you're in, it just kind of goes away.
Yeah, and it makes sense now that we've kind of talked about why scars form to begin with, why someone who scars badly, like who has a tendency to keloid, why they would keloid again.
It's so people's perception that have like keloiding and hypertrophic scars are like, oh, I'm a terrible scar. I'm like, no, actually, you're like the best scarer
That's just
ever.
it. Your body's trying too
You won
hard.
the scarring Olympics.
Yeah, your body's like, I got this.
Yeah, I got this. Hey,
Times
by the way,
1,000.
I'm not only going to scar, I'm going to double scar.
Right, I'm just gonna keep scarring.
Yeah, I'm going to show you guys who's boss
Right.
here. And what happens is that it goes out of control. And so people that keloid tend to have a very active and overreactive healing response, not underreactive healing response.
Yeah, and that's the same thing you see in children. Sometimes they scar worse because their body does heal so fast. Like it doesn't almost have a chance, It's just like, boom, it's done. We're healed. Let's move on,
Right.
And the opposite can also be true. And like sometimes like elderly, they'll have, a lot of injuries, but their skin is so slow to heal that when it does, they don't scar badly. Because the body just kind of took its time and just scarred how it wanted to,
You always see that in the elderly people, when they have almost like translucent skin and then blood underneath the skin. You're like, oh, please don't lacerate that. Yeah,
Don't puncture
I don't even
that.
know how I would sew that up.
No,
It doesn't even look like skin. It looks like tissue paper.
Yeah, paper to paper. But I think the surgical repair of scars, is really a great option for some people because scars can be chronically kind of angry or itchy or give people pain, or they can kind of adhese down like to the deeper layers, can kind of aggressively scar. And in those cases, cutting out that scar really can help. And you think like, well, it's just going to scar again. And yes, but you're removing the part of the scar that's overworking or maybe tight. Like you can kind of release deeper layers underneath it.
You just start from the beginning and maybe you can alleviate the problems that were there beforehand.
Yeah, so it's a good option. If someone is struggling with a scar that is causing them discomfort or itching, like absolutely seek out just the maybe opinion of a plastic or reconstructive surgeon to see if a revision might help.
And if you're looking at the slides, Sarah selected a slide of a pregnant woman rubbing something on her belly.
Scar, yeah, that's stretch
And
mark
I
cream.
am telling you, when I worked at Cook County Hospital, all the nurses there told me that any problem you have with
Cocoa butter.
cocoa butter.
Yes.
So if you're listening to this, cocoa butter, according to the nurses at Cook County Hospital in Chicago, will solve any wound healing problem.
Well, it is important.
I'm not recommending that as a physician, but they swore by it.
Right. And keeping a wound hydrated is, definitely helpful. You don't want to keep it wet by any means, but, hydrating a wound.
Yeah. So people, it's so funny when people like injure themselves and they'll come in, usually because we do facial trauma, but sometimes it's like a cosmetic patient and they have like road rash or something. They're like, oh, I got to get this wound to dry out. Because that's what you did in the old days, right? You would just get it dried out. I'm like, there's nothing worse for skin cells to kind of go across this chasm and heal than to have no moistness there, right? You need that. If it dries out, you're not going to heal it.
The opposite is also true, though. If you're keeping your incisions like doused in bacitracin 24 hours a day and they're just wet, they'll also kind of
some of that is us because we tend to
close.
put bacitracin on things, and people always think more is better. Yeah,
I always say it's lip gloss, it's not toothpaste.
I don't know what's going on. I'm kind of irritated down. You pull it off. It's like 5 gallons of bacitracin.
Yeah.
Yeah.
Let's clean this up a little.
Just kind of just take this stuff off, and we can take a shower. Showers are good.
Right, dry this off before you put more bacitracin on it. Yeah.
All right.
So, I kind of already talked about how to optimize wound healing and scar formation.
Sun exposure, big deal. So, especially if you're doing surgery of the face and neck, which we do a lot of, you got to you got to avoid the UV exposure because that can really mess with your scars.
Well, what it does is your body can only do, it can do many things at one time, but specifically with your scar formation. So, if your body is having to fight free radicals, it will stop doing this nice, remodeling of your scar. So in that phase from day 4 onward, essentially, or day 6 onward, once you get past the initial acute phase of your injury or your wound healing, your body's like busy building this, fixing this wound and remodeling it and building it for like the next 2 years maybe. And if you are assaulting it with UV rays, it's going to fight those. But while it's doing that, it's going to stop the project. So it's like if you're building a house and a fire breaks out in your yard, you have to fight the fire before you can keep building your house.
Very good point.
Or the fire is going to burn your house down.
Right. You don't want to burn the house down.
Right. So it's very important to avoid UV exposure on your scars, on your fresh scars. And the other thing, too, that I always reiterate is follow your post-op instructions. About everything, working
Somehow you always bring it back to this.
I do.
Debbie Downer.
Oh, but this is a positive thing, There's
you get surgery, do whatever you want afterwards. Right. That's what we tell our patients. They can go, go hang out, drink, smoke, do whatever they want.
Right. Get your heart rate up.
Yeah.
All of these things are to help your scar heal.
Right.
You and your scar to heal as best as possible. So keeping your heart rate and blood pressure low.
So this TMI, but I had surgery recently. It's very hard to focus on your nutrition and to stay calm and not work out, right? So you have to it has to be your job to heal from this.
It is.
Especially when you've had formal surgery, but even with an injury, you need to take a couple weeks and I need to heal this thing.
I need to feed my body correctly. I need to make sure I'm following my post-op instructions. All these things are going to help your scar be as good as possible, which makes everybody happy. Everybody likes a good scar.
Scars.
What's your favorite scar story?
I've told it before. It was when I was doing riding the skateboard down the hill, and I didn't realize how fast I was going. And then I did the running forward, and mostly it's a young man's story. You're running forward on pavement, and you're like, I think I can make it to the grass, and you jump and just slide
Superman.
on the pavement to the grass and totally. I injured that place that same area 3 times. What about you? I know yours was the buggy.
Yep. The baby
when you
model.
Were baby model buggy.
Yeah, my chin scar, which I always show people, so specifically our facelift patients, we're doing a full neck lift, and we tell them we're gonna have a scar under your chin, and they're like, oh my gosh, people are gonna see that. I'm like, who doesn't have a scar under their chin? Everyone has a scar under their chin.
Right.
Yeah.
That's true.
Yeah. No one sees it.
Nils?
15 in a row just stacked up.
Okay, right on the arm. Yeah, skateboarding.
They're still there too. It's
Yeah.
big. Yeah.
See? Every scar has a story.
We should write that book.
We should. That actually should be the name of your memoir.
Yes.
Every scar has a story.
Oh
Yep.
my God. I need to start writing that
Yes,
now.
you do. I've told you that before. You got to start writing your memoir.
Okay.
Well, thank you everyone for listening today. Sorry, this was kind of a sciencey episode, but it is important.
Science is good. You got to believe in science.
Science is good. If you'd like to follow us on Instagram. We are at Beauty and the Surgeon Podcast. You can also follow our practice at Dr. Martin at Jason Martin MD. We're also jasonmartinmd.com, and you can find us Jason Martin MD on YouTube.
Yeah, and get in tune with your fibroblasts, your macrophages, your neutrophils, your platelets. Be one with them.
That's right.
They save you.
They
These
do.
are your friends. And inflammation's not bad, at least for the first couple days. And then afterwards, we want inflammation to go away. About right.
That's right.
Okay.
All right. Thanks, everyone.
That's wound healing.